They come in quietly or carried by pain, through the outpatient department, the emergency room, the care home, the healing home. Home. In the care universe, intercoms tag them like robots on an assembly line. Case file 214, patient 619. Across thin walls and screens, staff voices echo carelessly. Bed 6, the fracture in Ward B, the appendicitis. In this stronghold of care, ink comes before identity, paper before pulse, and name dissolves into handwriting no one reads twice. But patients are human too. They arrive carrying whole worlds, unfinished conversations, uncompleted jobs, unspoken stories, all pressed into uncertainty. Of course, they have to be patient. Patient for someone to see them, patient for results, patient for medications, and watch helplessly as their lives fit neatly into hospital gowns and diagnoses. In corridors thick with urgency, voices sharpen into instructions. Hold still. Don't move. Next. As if pain were a procedure to be processed quickly before the queue grows restless. Needles enter without apology, a sting that lingers longer than it should. Cold hands examine, press, withdraw, clinical and efficient, forgetting that skin remembers. Patients are human, too. They feel the weight of silence when questions hang unanswered. Hollow when eyes stay fixed on monitors instead of meeting theirs. Their dignity slipping when curtains are left half-drawn or a gown is pulled too far. They hear conversations spoken over their body as though absence has already claimed them. They understand tone, the chill in a hurried voice, the distance in a fleeting touch, the way compassion is rationed like a scarce commodity. In certain wards, the elderly fade into corners, their words dismissed as echoes of a failing mind. But confusion is not consent. Forgetfulness is not forfeiture of dignity. They, too, remember, in fragments perhaps, what it means to be held gently, spoken to kindly, seen fully. Patients are human, too. There are those who cannot speak, lips stilled by tubes, voices swallowed by machines, babies whose cries are translated into charts and numbers. But muteness does not mean they do not feel. They feel impatience, neglect. They can tell when care becomes careless. Patients know fear, real fear, like when the next bed's occupant falls suddenly silent, and by morning their bed is gone. No goodbye, just empty space, and the diagnosis on the chart of the empty bed mirrors that of the living. Theirs. Some are left behind, abandoned, even through visiting hours, neglected by those once called loved ones, their beds holding more absence than presence. Still they wait. They all wait, not just for healing, but for humanity, for someone to say their name like it matters, to pause just long enough to listen, to remember that beneath every diagnosis is a person aching to be seen, to be heard, to be treated not as a condition, but as a life, not a burden, not a waste of time, not a file, not a task to complete. Because healing is not only in prescriptions or precise incisions. It lives in dignity, in respect, in remembering this is not just a body, not just a case, certainly not a bed. This is someone who will remember how they were treated long after they leave. Someone who could be you.